The United States is changing dramatically. It's becoming much more diverse in terms of race, ethnicity, and language. By the middle of the 21st century, the United States will be a majority of what we currently refer to as racial and ethnic minorities. But it's not just race and ethnicity, but also language and religion, nationality. These cultural dynamics are coming into the healthcare system and having an impact on the quality of care that we give, as well as the length of medical encounters, which affects patient throughput and impacts the bottom line. The Joint Commission has established new standards and elements in its hospital accreditation program to help healthcare organizations to adjust to the changing dynamics. NCQA is also making changes in its recognition programs. The Department of Health and Human Services have established the class standards, a set of standards that healthcare organizations use to establish a set of best practices for addressing these changing cultural dynamics. So as these changes occur and the regulatory environment occurs, there will be increasingly compelling reasons for healthcare organizations to address cultural competency. The issue of cultural competency has been around for over a decade now. And many of us are interested in the concept, but one of the things that always troubled me was that cultural competency was never really a very rigorous concept. We didn't have ways of measuring it. We didn't have interventions that were supported by research. So I decided to try to create a measure, a way of creating a metric that one can use to assess where that organization is and help an organization monitor its progress. The COA360 is an assessment tool. It's a set of questionnaires that are completed by hospital employees, including administrators, clinical staff, and non-clinical staff, and also questionnaires completed by patients. These questionnaires are all compiled into reports which give healthcare organizations benchmark data on various domains of cultural competency, as far as language services provided, communications, and its overall responsiveness to the changing diversity of the patient population as well as its employees. The COA360 works in several different modalities. We have a web-based version where all of the questionnaires can be completed online through the use of either an app, such as an iPad app, or through a website. If you use that modality, the healthcare organization has real-time access to their data and the ability to do their own analysis of the data. Alternatively, patient questionnaires can be completed using telephone surveys, or it could be done on paper. Through that modality, the paper surveys would come back to us and we would enter the data and a final report would be created, but also the organization would have the ability to log into a password-protected site, access their own data, and conduct their own data analysis. So once you've received your report, if you find areas that are in need of improvement, we have consultants that we work with that we can refer you to who can help you to work on changing processes within your organization to address those areas of deficit.